All right, welcome everybody to our non-malignant panel discussion. This panel discussion was really brought together by non-malignant participants who really wanted their voices to be heard. Who really wanted their chance to tell their story and to say, this is how non-malignant brain tumor diagnosis has impacted me and my family. So I feel very honored and privileged to be here and be part of that discussion. As I mentioned before, for those who are in the room, they've already heard this, but for those who are at home, if you have a question, you are able to type it in. From what I understand, and through the miracle of the internet, I always say internets, but people tell me it's internet, we're going to get those questions to you, and we're going to do our very best to have those questions answered during this time. So this panel discussion does rely on our lovely panelists who are going to join us in a few moments, but also relies on the audience participation as well. So if you do have a question, let me know, and I will come by, and I ask you all to talk into the mic so those at home can hear us. Okay, so without further ado, I'm going to introduce Rachel, Liz, and Debbie. They are survivors. Rachel is a caregiver to a brain tumor survivor, and she's going to begin telling her story right now. Thank you, Rachel.
I guess I'm on. So welcome everybody. It's really nice to see everybody here, and I think the large group speaks to the need of talking about non-malignant brain tumors. So I appreciate the Brain Tumor Foundation of Canada of allowing us to have that shared discussion. So my name is Rachel Brown. I'm from Fredericton, New Brunswick, and my daughter Janica was diagnosed in 2011 with a polycystic astrocytoma brain tumor and has endured 2 surgeries as well as an aneurysm clip. And her first surgery was on Super Bowl Sunday. So Super Bowl Sunday is not only about football in my house anymore. It's about celebrating almost 8 years of survivorship and of hope and of courage and of strength, and I'm so very proud of her. So I'm not sure what else you need us to say at this time. Is that good?
So just an introduction for now would be great. Thank you so much,
Thank
Rachel.
you.
Liz.
I'm not standing up.
You don't have to, you can, this is such an easygoing room. You can stand, you can sit, you can even lay on the floor, even though I don't think the camera would appreciate that as much. Okay. But please, share us a brief introduction of your story.
Anyway, my name is Elizabeth Juke, and I'm a brain tumor survivor. I live in Belleville with my husband, and together with my 3 great boys, we coordinate the Belleville Brain Tumor Walk, and we're very, very proud to do it. 2019 marks the 19th Brain Tumor Walk in Belleville. So I thought I'd bring in the new millennium with something special, and so I did, and ended up being diagnosed with an acoustic neuroma early in 2000. Acoustic neuromas are a very slow-growing tumor, and unlike some people, I really had very few symptoms. Not sure if that was a good thing or not. I didn't have headaches. My balance was a bit off. I attributed that to maybe higher heels that I shouldn't have bought. I was almost deaf, but really, so were my dad and grandfather. I just figured it was hitting me a little younger. When I pretty much walked into a post one day and the roaring started in my ears, it occurred to me that there might be something wrong. And you know what they say, a little knowledge can kill you. And being a nurse, I assumed I had Meniere's. Then I figured, oh, I've got MS. And the test showed differently. My husband being in the military, we've moved around quite a bit, and at that time we were living in Fredericton, New Brunswick, and there probably isn't anyone in this room that will remember this, but in those days they had a traveling MRI machine that went from St. John, New Brunswick to Fredericton, and the day I was having my test, it just happened to be pulling into town. So anyway, from the test, they, of course, found out that I had a tumor. And that evening, I was talking to my neurologist, Dr. Brian Wheelock in St. John, and 2 weeks later, I had my first surgery, and 2 weeks after that, I had my second surgery. They told me my auditory nerve would be cut, and I thought, no problem, I've got another year. It's a bit challenging. Your equilibrium and your balance is off. I can't walk a straight line at the best of times, and I was told my facial nerve would be manipulated or cut, and I think my face pretty much tells that story all by itself. But I had a wonderful facial surgeon in Toronto, Dr. Magtalo, that was quite helpful with that. My eye has a gold weight in it, and I like to think I'm worth a fortune. But you know, you can't have your cranial nerves, or I call it my command center. They can't mess with those without expecting you to have consequences. And you know, my eye is just a constant source of distress for me, and I figure I keep the eye drops and the eye lubricant producers in business. So yeah, there's a lot of things that happen, and many people say, oh, you know, you survived, your tumor's out, everything's back to normal. Well, I'm telling you, it never goes back to normal. And anyway, I'm happy to be here, and happy for the support that I got, and really proud to be a part of all.
Thank you,
of it.
Liz.
Sorry, I rambled.
Oh, it's fine. Go ahead, Deb.
Hi, my name is Debbie Pyres. We moved 2 years ago to Port Stanley, Ontario, which is about 20 minutes south of London, but we live by the beach, so that's a little stress reliever for me when I feel a little stressed out. I was originally diagnosed in 2003 with an acoustic neuroma, so I had the same tumor as she did. My onset was very sudden. I had no warning. I worked for Bell Canada at the time. I was on conference calls every day, and that day I happened to pick up the phone, and I thought my boss was speaking Latin. I was like, where are you? What's going on? I can't hear you. And I switched ears, and the other one was just crystal clear, and the other one was garbage. From there, I went through a lot of tests before I was diagnosed with an acoustic neuroma. I had my surgery in 2003. My initial surgery was 16 hours. I was very lucky to have no facial damage. I had a fantastic neurosurgeon on my side. But I had a lot of complications after that, some that most people I hope never have, and 2 surgeries since then. So,
Yeah. When was your last surgery?
last week.
Last week.
Last week.
Yeah.
Yeah.
Thank you so much for being here. Yeah. And if you can hang on to the mic. So what has been your greatest challenge since being diagnosed?
My greatest challenge.
Whether it's personally or even interacting with the public?
Well, I lost my eardrum in my second surgery, which was during SARS. I had 5 CSF leaks. So I think it's the public not seeing my disability. So I am deaf on one side completely. I have no eardrum. And I have sometimes a hard time comprehending in large groups what people are saying. I had a harder time in the workplace, so I now work for myself. I became my own boss and created my own job. So I think that's probably the hardest challenge.
Yeah. Those things that aren't seen.
Yes.
Yeah. Yeah.
Yeah.
And what have you done to overcome that? So when you're, besides creating your own job, what do you say to the public who may not know that you still have
Those challenges.
those challenges?
I warn everyone ahead of time, I'm deaf on one side. I'm not being rude. I am not ignoring you. You can hit me if you have to. You have to warn everyone of that. People always forget, so I'm always sidestepping and kind of walking to the other side of them so I can hear what they're saying. And I think just personally, I've always just kind of put one foot in front of the other and dealt with one challenge at a time, and that's all I can manage. So I did recently have my last surgery last week. I did develop a growth in there that it like a cyst in the tumor site, which they have never seen. It's like a piece of skin that grew into a cyst that they had to go in and take out. And I think after 15 years, I thought I was done. You know, they gave me my 10-year clear, and I thought, I'm finished. This is great. And beforehand, I had no kids, and now I have 2 kids. So that's the biggest challenge with them too. I have daily headaches, massive headaches. That's probably one I forgot. And I have headaches from one of my complications. They accidentally froze my brain, very long story, but freezing solution in my brain. And I have massive headaches from that ever since, so.
Thank you.
Yep.
Liz, same question. What is your greatest challenge, whether it's personally or even out in the greater world? What would you say that is?
My biggest challenge is my eye. Like, it's just, you think it's such a small portion of your body. How can it possibly give you that much of a problem? But that's probably my biggest challenge. Like my other panelist here, I'm deaf on the right side, and I've learned to position myself at tables or restaurants, and I always say, you know, I'm not ignoring you, I'm not being rude, hit me, just don't hit me too hard. And I guess probably the biggest challenge for me was I was always, well, I still am, a very smiley person. So when you walk down the street and you can't really smile at people, and often there are people who look at me that just, they've never seen any kind of facial paralysis. And, you know, some people are great. They're just, you know, oh, you know, that's... And then there are others that kind of stare.
Yeah.
And, I mean, you get used to it over the years, and depending on my mood,
Yeah.
you know, but... Yeah, there have been lots of challenges, but I mean, what are you going to do? Like, stick your head under a barrel and not live your life? Like,
Right.
you just have to go out there and keep going.
Good. Thank you. Rachel, same question, but from a caregiver perspective.
My biggest challenge?
Yeah.
My biggest challenge is to tame my worried heart.
What do you mean?
So as a mom, there's a lot of moments that occurred when Janica was first diagnosed that are certainly I don't remember, or perhaps my heart or my body is choosing not to remember those moments of shock and worry, and in terms of wanting to trade places with her in a second, I would have. Challenge for me as well is in being her advocate, because she was 13, and certainly when she first had her first surgery, she was paralyzed on her left side, wasn't able to speak for herself, wasn't able to really care for herself. So was, even though it was considered non-malignant, it's very, very serious and is life-threatening. So I think the challenge was about eliminating that misconception that because it's non-malignant, it's not life-threatening. So it was about educating myself and being someone that can then educate others so that they would understand the seriousness of it.
Yeah.
Janica has had some challenges as well. I think our perspectives are obviously different, but obviously. As a teenager, you know, she lost some friends along the way, because it's one thing as adults for us to try to maneuver this life-changing moment, but as for a teenager, you know, there's and nothing negative about those kids. They just didn't know how to handle that at the time. And she's had some issues with memory and bladder and sleep and just other type of symptoms that she's had.
So leading on with social misconceptions, because I think that's a big point of the conversation here. What do you think are some of the biggest social misconceptions of being diagnosed with a non-malignant brain tumor?
That you're going to be okay, that you're going to live forever, that nothing has changed in your life, that, oh, okay. That potentially everything goes back to normal, whatever normal is. So for us, it's been a challenge in terms of schools, in terms of some of the accommodations that she's needed, being a positive advocate for her, trying to be a team player in that, and with the schools. And I must say, if if any of them are listening online, the schools that Janica attended and is attending right now in university have been amazing resources and support to her. So it's about giving that information. If those individuals don't know, then it's part of our role to inform them. Once you know better, you do better, and if you don't inform them, then they don't know how to help. So I think it's about offering that information to those who are willing to listen and finding creative ways to distributing that information.
Great. Yeah, thank you. Liz, what has been some of the biggest social misconceptions that you have had in your experience?
Well, quite honestly, like I didn't get involved with the brain tumor community until about 7 or 8 years ago, and Jeanette was in the Belleville Hospital doing what she does best, handing out books and educating the health caregivers there, and she lifted up the Non-Malignant brain tumor book, and I thought, really? You have 2 different books? Like, and I thought, why? Like, why is there even a distinction? A brain tumor is a brain tumor, and you know this. What about me? What about the caregivers? And, you know, what about the moms, the dads, it's, I don't know. We've all got a story, and we're all entitled to tell it. We all need to be validated, no matter what your situation is. We all deserve to be validated, and I don't know, I just think it's a really competitive life. Big job, big car, big house, and I don't think there's any room for that in healthcare, and certainly not in the brain tumor community.
Yeah, thank you. Thank you. Deb, same question.
Social misconception?
Yeah, your biggest social misconception since being diagnosed with a non-malignant.
Like your daughter, I lost a lot of friends. I was 27 at the time that I was diagnosed, so I was dating my husband at the time. And I found that we stopped being invited to things. It was like, people thought my head was cut off. Even work, they treated me like I had my brain cut out, and, I didn't know what I was doing anymore. The people I had trained were pretending to train me, and it was very frustrating. I think that's the same for anyone with a brain tumor, not necessarily non-malignant or malignant. I think people just have the perception that it's in your brain and somehow it's affected your ability or who you are. And some of that might be that they don't know how to treat us or how to handle it, like you said. But some of it is just, it's easier for them to block it out. I think you learn who your friends are.
Yeah. No. And if there are any questions or any comments, just let me know, and I can come around, but I can talk also for hours. So it's okay, don't feel obligated, but I can keep this discussion up. But if there are any questions, please let me know, okay? Claire, by all means.
Thank you so much for sharing your story. I have a question for you being a mother.
Yeah.
How do you manage that whole dynamic with being a mother, but as you said, having ongoing symptoms and so forth? Because obviously being a parent and having that whole dynamic can be challenging.
My situation is very unique. Not to go long into a story, but my family, the 4 of us, we've all had our challenges. So I started with a brain tumor. My oldest daughter was born with special needs. My husband had kidney cancer, and my youngest had a brain tumor 2 years ago. So I think that we just handle everything as it comes, and if I have a bad headache and I need to lay down, my husband takes over. And my kids knew from a very young age, and I told my neurologist when my headache started, I was with my youngest doing mom-baby swimming classes, and I couldn't see. I couldn't move, I couldn't see, I could hear, and I was paranoid that someone was going to steal her. And I worked with my neurologist to say, I don't care what you do, but you need to find me a drug that's going to work. Because I was stuck for hours, for 2 hours with Tylenol 3 waiting for it to kick in to the fact that I could move. And so we did finally find one drug that within 10, 15 minutes I'm able to at least move. And so we worked on those little things that made little things, and when we need to stop and take a break, we do. And that's the only way I can say it.
Thank you so much, Deb. We have another question.
Yeah, it's not a question so much as wondering how other people feel about this as well. When I saw that they were going to do a brain cancer awareness day, my heart kind of dropped. And yet, am I glad I don't have brain cancer? Yes, I am glad I don't. But it doesn't mean to say that it almost feels like a push sideways again from the organization that is supporting us. And I just wanted to know if it hit other people the same way or not. So.
Yep. Comments? Yep.
Yes. It's exactly what we just spoke about and what we spoke about at the table, because like Liz says, why is there this disconnect, this competition within the community? If it's ultimately to get money and raise funds and whatever from government people, the funds will get allocated where they're needed, if that's for GBM research, if that's for acoustic neuroma, meningiomas. I mean, when you talk about the barriers socially, it's, Rachel, is that it? It's like what Rachel says. People, oh, you're non-malignant. You don't have cancer, but that doesn't mean you don't have deficits, memory, headaches, issue handling, stress. Like, I mean, all of us sitting here that have non-malignants will say, I'm sure we all have an issue or two or three, but, well, you don't have cancer. And so I don't feel there should be this disconnect. It should be a National Brain Tumor Day.
So
on that note.
I hear what you're saying, and I came in prepared because I knew this was going to come up. So that day is right in the middle of National Brain Tumor Week. Why they had that day and why they said it's Brain Cancer Day, I don't know, but I'm sure there is room there because there are 4 more days available to have that. Why they have that distinction, that is a great question, and that's one I think that we need more conversation about. But this is a good start in order to have this conversation here today, right? Catherine.
So my oncologist told me one time, like I have a malignant cancer, but he told me that anything that grows in your brain that is not supposed to be there, you should call it cancer. And so I like everybody that is here that has a benign cancer or a benign tumor.
Yeah, that non-malignant,
it should be anything that grows in your brain that is not supposed to be there should be called cancer. That's what I say.
Yeah. Thank you for that. And it's true. Anything that is not supposed to be in your brain that does grow is impactful, right? And I think keeping this discussion going, especially with non-malignant brain tumor survivors, they live longer, and the impacts of surgery, radiation, chemotherapy, because non-malignant brain tumor survivors do go through radiation and chemotherapy, right? They're going to feel that impact, right? And they're going to have those lifelong ramifications of going through surgery and all those other treatments. So I hope this is a step in the right direction. Okay, good. Comment. Here.
I have a quick question concerning. My name is Sheila, and I'm a facilitator for the Sudbury Brain Tumor Support Group. We have a lot of members in our group that suffer from non-malignant brain tumors, and one in particular had a very difficult time with her work. Because it was classified as non-malignant, she had a lot of problems with the insurance company and them supporting her, and she ended up quitting her job because she just couldn't take the stress anymore. I wondered if you had experienced the same thing.
I did have the same experience. I was up for promotion at the time that I left when I was sick, and when I came back I was told I wasn't the same person and I had to earn that promotion back. Of which then I was pregnant, and then, you know, I never got it. I ended up leaving. But yeah, I did find the same thing. I also found that the insurance company tried to push me back to work very soon, and my GP would have sent me back to work. It was just that my neurosurgeon said, you're not going back. You've had 5 CSF leaks, you're not going back. Like, you know, you need to take the time to heal. But if it wasn't for him, they would have forced me back sooner.
And that's what I've told a lot of my members. I've had a couple that have had the same pressure to go back to work. And we've had the discussion, and I've said, if you don't feel that you're ready, then don't go back, because you're only putting yourself in more jeopardy by going back, and then it becomes a new case. So I said, as long as your doctor supports you
Yeah.
in what you're really feeling, you really have to be vocal as to what your needs are.
You have to be your own advocate.
Correct.
Yeah.
Thanks, Kathy. We just have one more question another comment from Denis.
This is a question for Rachel, actually. So you had mentioned that that your daughter had received great support throughout, through the educational institutions, etc. Did you feel like you had any needs that were unmet as a caregiver? What and what might you have received? Just in terms of your own support, what your needs were. Do you feel like they were met? Or did you feel like there were a lot of your own needs that were unmet? And can you speak to that?
Good question. I don't know if you could completely say that all my needs were met, because I think each situation is unique. For me, I was lucky enough to have a large family and a supportive husband, supportive workplace. I had to send out 400 thank you cards with the picture of Janica on the cover of it, because I had hundreds praying for her and thinking about her that didn't even know who she was. With the IWK in Halifax, they look at a holistic approach, which probably is a little bit more unique when you have a child than, because she's now on the adult side. So there's been some changes there. So holistically, they made sure that they had that team approach around my husband and I, even my parents, her, in terms of making sure that we had access to a social worker, psychologist, clinical psychologist, all of those, clinical neuropsychologists. I can't remember them all, but anyways, we had a lot. And when we left the IWK, she was then transferred to the Stain Cassidy Rehabilitation Center, which again had a holistic approach, because she was on the pediatrics. I would say the shift has been when she became on the adult side, because if it wasn't for her allowing permission for me to be a part of her medical team, I probably would be out of the loop. And my fear was, because she had some cognitive deficits, or her memory, would she remember everything the doctor was going to say to her or give her for advice? We have the same family doctor, whom is very, very respectful, obviously, and has allowed me to speak. She knows that. It'll be in front of her. Obviously, he's going to consult with her, but I have been an advocate for her to say, if you're going to meet with her and you're going to instruct her to do this, or suggest this and this, can you please write it down? Because she's not going to remember. And he was like, Rachel, thank you so much, because I forgot, because it's invisible. I think because of my ability to see that I needed to get my support in order to best support her, and that's not always everyone's strength either, to recognize that. So I sought out the support that I needed when I felt like it wasn't there. But I would highly recommend that those who aren't getting their needs met, any parent that I'm now connected with, I say, please make sure you're connected to a social worker, a psychologist, someone with that clinical background to give you some validation, to make you feel like you're not losing your mind, to allow you to cry, to allow you to talk about your worst fears, and to allow you to find some things so that you can bring that joy back, which is what I appreciated from Judith talking this morning, is not to postpone that joy in some of those most difficult moments, but there's a lot of people out there willing to help. Now, having said that too, it was built in for us in developing those relationships, but right now at university, I would say that there's probably more of a barrier for me accessing that type of support for her at the university level, probably. So I hope that was helpful. Yeah.
Thank you, Rachel. And I think one of the biggest things that I've heard is, before your loved one is released, what is the plan? What is the plan before your loved one gets home, so you know that all these supports are going to be lined up?
Well, I think in making sure that they follow up with that plan, and I think when we talk about a navigator, in an ideal world, it would be awesome that we had brain tumor navigators, brain tumor team navigators to navigate that system, because I certainly got a bag just like this. And it was 6 months until I looked in that bag when we got home from Halifax. And even then I was like, oh, right, yeah, she may not come out of this. So it's getting the right information at the right time where you can process it, and also bringing somebody with you so that you can make sure that you've gathered that information correctly, so that you can say, is that what you heard? Or is that not what they said? And calling back. If they say they're going to call you back next week and they don't call you back, call them back and say, you said you were going to call me back. And sometimes that can be frustrating.
Yeah. Thank you for that, Rachel. I do have an online question for the panel. My question has to do with depression, and this is from Gloria, who's one of our online participants. This is a very common side effect of brain surgery, and I believe that it is serious and undervalued issue in general and is not adequately handled by surgeons or hospitals. So I was wondering from the panel if they had a comment or any kind of depression following brain tumor surgery.
Well, I'll just say briefly, and then you guys can make your comments. When I had my surgery, I was in Atlantic, Canada, and it is one of the greatest parts of the country. I mean, they're a very laid-back, wonderful bunch of people, and I had stepped out of nursing, and I was selling real estate, and I'm telling you, like, I had so much support, and when I saw this face, and all I kept hearing was, we can't wait for you to come back to work and start selling houses again, I thought, well, for heaven's sakes, if they can accept me back, I'm sure the whole world can. But I mean, I was really lucky like that, and I feel very fortunate. Like, I think things happen to you for a reason. I agree with that. But I think things happen to you, or at least I think things have happened to me at the right times in my life. And so I was really, I don't even know if I'm answering the question properly.
Yeah, no, you're talking about the effects, right? And feeling that that you're kind of uncertain.
But I think had I been somewhere else and I didn't have that support, we also had my husband's family there. My kids were younger, and they were so supportive. Otherwise, I think I could have really sunk into a huge depression, so and I can certainly see how people would.
Yeah, reducing that isolation, right? Yeah. Any other comments from the panel about that question? Debbie?
I guess with my initial surgeries, I didn't have a lot of depression. I tried to stay kind of upbeat. Nelson did a good job. My husband now did a good job in trying to keep me upbeat. We played a lot of Xbox. I think when all the complications hit, I had a hard time. It's kind of like, enough already. Like, what's next? My biggest bout of depression happened after my daughter was diagnosed. I had a lot of guilt. So that's kind of a side conversation. But, being a brain tumor survivor and then she was diagnosed, it was kind of like, what did I pass on? So. Yeah, I did seek help for that, and it was very helpful, and I think you do need to ask. When you get to a point where you're like, I can't anymore, I think you do need to reach out and find someone, whether that's a friend, whether it's a professional, that you can have as a sounding board that will listen and just say, you're not crazy, and find ways to deal with that.
Yep. Rachel, and what about for Janica?
I would say for Janica, she had a lot of social filtering deficits in the beginning, so it was more about being aware of our own feelings, and I would actually say that probably for myself, I suffered a little bit from PTSD probably 6 months after, is when it really kind of hit me. I didn't know it was Super Bowl Sunday till my brothers were talking about it in September, hoping they could watch Super Bowl Sunday, and I said, well, where were you this year? And they were like, at the IWK. I'm like, oh, okay. But I think it's about exactly what you said. If you have those feelings, don't minimize it. You know, and if you're caring for someone who's gone through it, or if you have you just need one person who you trust and just say, I'm not feeling right. I'm not thinking right. You know, can we talk about it? I don't know, shops therapy is great. Xbox would be great. I remember feeling fearful of having a glass of wine, thinking that might help me. Not that there was any issues, but I thought maybe if I have a little glass of wine, if it's enjoyable too much, I might want another. And I was very scared about that.
Yeah.
I was fearful that I'd be dependent on it. And I think about just not minimizing, but to be mindful of Janica. So I felt like I knew her best in this new normal, and I was watching for signs, especially when the friends started tethering off, and having that open conversation. Even if she didn't reply, if we were in the car, I would just try to have and just say, you know, it's okay if you're feeling sad, because I felt sad, openly cried in front of her, but not always having to be happy either, because it allows for those conversations to happen.
Being genuine,
Validates it.
right?
Yeah. So, because it's a life-changing moment, and the guilt. Yeah, the guilt as a parent. So.
Thank you. We have a comment right here.
I felt, because I was pretty young when I was diagnosed. I was like 11, 12. And I think that as much as people supported me, I always felt like I went back to being alone. And then, you know, my mind, I would like ruminate, and I would think about, oh my God, this is going to happen. This might happen. So I would always get stuck back at, like, you know, the depression. And I think the biggest step that I had to take was believing that you can be happy and you can also have cancer or a tumor. You have to really, like, take that step and believe that, because happiness and having cancer are two things that can be together, which is, like, you know, something that I think is important.
And what's your first name?
Thank you, Catherine.
Hi, Catherine. Nice to meet you, Catherine. And if I would say something about that helped Janica, is that she began to sharing her story with other people, and she then received feedback from other people saying, you're inspiring me, and I felt like you have felt, and I feel less alone because of you, which then empowered her to feel less alone. So very nice to meet you, Catherine.
Thank you. This is going to be our last comment, just for time's sake. So, Lori, please take it away.
I wanted to say about the guilt, something I don't know if other people get, but sometimes I get survivor guilt. My father died of a brain tumor, and my stepfather died of a brain tumor, and here I am, 17 years old. So sometimes I get afflicted with survivor guilt or the feeling alone. And I think sometimes the depression doesn't necessarily hit right away. It could be years even later. And then all of a sudden you're like, something doesn't feel right. And I just kind of call them my days I need to cry. And my husband will say, there's no crying. And I say, oh yeah, there's crying. But someone at our group on Wednesday, they made a really good comment, and they talked about we grieve the loss of who we were, and we have to accept who we are because we always use new normal. So yeah, it's about grieving the loss of who you were and really accepting who you now are. Even though you're the same person, we're not exactly the same.
Well, thank you, everyone, for joining us like this. All right. So I'd like to introduce our panelists. We have Gil, Natasha, and Jenny, Jennifer. What would you? Jenny. Is that Jenny? And Jenny. They're all going to share with us their story and ask and answer questions from the panelists and from the audience for the next 15 minutes, I believe. Okay. So I am relying on the audience participation to ask questions, but if not, I have tons of questions that we're getting in from the live stream as well. So I'm going to do my best to juggle both. Okay. So without further ado, Jenny, would you mind just sharing a brief introduction of your story, your diagnosis, and kind of what you hope to get out of today's discussion?
I sure can. So my name's Jenny, and I have a non-malignant brain tumor. I'm really happy to be a part of this and that the Brain Tumor Foundation is hosting us today. Thank you so much for doing this. I think it's a really good, or it's something that needs to be discussed, and couldn't have a better platform to do so. I was diagnosed 3 years ago on my 9th wedding anniversary with a very large skull-based meningioma. Surgery soon followed, along with radiation. I did have many complications along the way. I was diagnosed with hyponatremia post-surgery, and I ended up having 2 grand mal seizures, and I went into a coma, and I was in the hospital for a couple weeks after that. But I survived and came through. I then went through my radiation, which seemed fine. About a year after radiation, I developed there's a lot of hypo words, hypopituitarism, which is my pituitary gland no longer functions, so I am now completely hormone dependent, which has been a whole nother world in and of itself. So I feel like I am still processing 3 years later that I have a brain tumor, and trying to deal with the emotion that comes from that. I feel like emotion comes more now for me. In the time that I had the tumor, surgery, all of that, I was on such a rush. I didn't even really process what was going on in my life, and I feel like now has been the biggest challenge of all, just trying to process what's going on. I do have frequent migraines. That's a very big problem for me now. I know some of the questions we looked at. I was misdiagnosed for 2 years. Prior to diagnosis, I was misdiagnosed with Polycystic Ovarian syndrome. I was medicated for this disease, and I did not have it. So when I look back now, there were so many signs that were missed. I was producing breast milk. My son was 4 years old, so there was no reason for that, but I was told it was indeed normal and that I shouldn't worry. It was due to stimulation or whatever the doctor had said at the time. When I lost vision in my left eye and had to go to the hospital, I was turned away 4 times. 4 times I was sent home with pain medication and told that it was just a migraine and to move on and come back if it didn't go away. And it wasn't until I saw an eye doctor that they finally pushed me in for an MRI. So I feel like I don't know if there's certain symptoms that I was missing that I didn't present with the doctors to kind of be just pushed off with, that I want them to be more aware of. You know, just because I didn't have maybe a neurological issue at the time and everything was relatively functioning, I had lost vision in my eye. I know that a migraine can bring that on. It does happen to me still, but you know, there has to be a certain level of trust with the patient that the doctors are seeing and how we're treated. Yeah, so I just want to talk a little bit about some of the changes that I've been doing to try and implement that, or are we waiting?
We'll get there.
Okay,
I
we'll
promise.
get there. You're the boss.
Yeah. Well, not really, but we'll get there, I promise.
Okay.
Thank you for sharing
Yes.
a brief story.
Thank you.
Yeah. Natasha.
Okay, that's going to be kind of hard to follow. I don't have any notes. So
That's okay. Just it's your experience.
Yeah.
When were you diagnosed?
Mine's actually very
With what?
recent. It's been just over a year. So July of 2017, I started having headaches. Nothing overly out of the normal. I didn't really get headaches, but I also don't usually run to the doctor for everything anyways. So I had this headache, kind of went on for a few days. I was like, hey, maybe I'll get it checked out. Went to a clinic, told me I had a migraine. Take this migraine medication. If it doesn't work in 4 hours, take it again. Doesn't work, come back. Well, it was late in the night, so I wasn't able to go back, so I went to the hospital. They pumped me full of pain meds and fluids, and they kind of kept checking me for a stroke and things like this, and I was 25 at the time, so I'm kind of starting to freak out. But still, nothing happening. Sent me with some pain meds back home. This should help you sleep. You know, if it's still bad in the morning, come back again.
How long did that go on?
I started having a headache on a Tuesday, and I went to the clinic on a Thursday night. Friday morning, I went to the hospital because the migraine medication wasn't working. And all of this happened at a really bad time kind of for me. I was in my best friend's wedding the next day, so on a Saturday, and it was 2 hours away, and I'm really stubborn. So I had a pounding headache, but I was bound and determined to make it through her wedding and to be there for her. So I went. I drove myself there. I probably shouldn't have, but I did. And when I get there, I went, got my hair and makeup done, all those things. I made it through the ceremony. I was trying to take different migraine medications. I tried having a few drinks. I tried everything to make this pain go away. Nothing worked. So finally it comes to the reception, and I was in excruciating pain, and I had to look at my best friend. I was like, I'm really sorry, I need to go to the hospital. So I went, all dressed up, 2 hours away, with nobody. So I went to the hospital, and they took me in right away, again, pumped full of all of these pain meds. I was on morphine, every pain med you could possibly think of. He sent me for a CAT scan. After a few hours, CAT scan comes back. You're fine. It looks like you have a sinus infection on your right side, and it's spreading to your left. I was like, okay. At this point, my dad had come to pick me up. So I get in the car. We have a 2-hour drive back home. We pull into my parents' driveway, and I was kind of sleeping on and off, trying to rest, because it had been a hard week. So we pulled into the driveway, and I looked at my dad, and I said, is my left eye swollen? He's like, no. Can you not open it? I was like, no, I can't. So I couldn't open my left eye, and then we knew something was wrong. So as soon as I started walking in the house, the left side of my forehead started going numb. And as the hours went, it progressed down the entire left side of my face. So I got rushed back to a hospital. Again, still more tests. And they're like, you've been healthy ever since. No problems, no vision problems, no nothing, no seizures. Nope, nothing. Not a thing. Okay, so after tests and tests and tests, and I'm in excruciating pain, and my face is numb, even down into my throat, which was scary. The doctor comes back in. Actually, he was a little frustrated, and he tells me, you've had a tumor behind your eye for 10 years. Why didn't you tell me? I was there with my mom, and I was like, beg your pardon? I didn't tell you because I didn't know. So when I was 15, I had a scan done, and I guess it showed up there, and I was not informed.
Oh, wow.
So from there, this was a Sunday by now, so headache started on Tuesday. It's Sunday when I found out, and they sent me back home with some pain meds. Needless to say, I didn't really sleep. Pain meds really didn't do much. I was watching the clock like it was my day job, though, because as soon as that 6-hour mark hit and I could take my pain meds, I was happy. And then Wednesday, I got admitted to a hospital in Toronto. Wednesday night, I had a few MRIs. Thursday, I found out that I was having brain surgery. I was on a waiting list, and it was either going to be a couple days or a couple weeks, and he's going to go in and try and do a biopsy, because where it is, he can't take it out. It would be very bad. It's in my cavernous sinus, which is why it affected the entire left side of my face, because that's all the nerves on that side of your face. I'm being told that they don't know if my eye's going to open, if I'm going to get the feeling back. Essentially, they don't know what's going on. So Friday morning, a little bit of a miscommunication, but I end up going first for all of these surgeries. So I get my nurse to come in at 6 a.m., and they're telling me I'm going to the operating room. So lucky me, I actually didn't have anyone with me because it was a miscommunication, and I told my parents to go home and sleep because we'd all had a rough week. So I had the surgery. I guess long story short, he was able to go in, he was able to drain it. I guess whatever's growing in my head is not supposed to be in this exact area. So he drained it, which was good, so he took off some of the pressure. He wasn't able to do a biopsy, so they believe it was either a meningioma or a schwannoma, even though there's 2 parts of it, so he's not really sure. My neurosurgeon is leaning more towards schwannoma. And so after surgery was the healing process, and for about 5 months after, my eye was still closed. So July to about December, and then in December my eye started to open. But when it did, it wasn't what I thought it would be. I couldn't see properly, and every time it was opened a little bit, I felt sick, and I didn't understand why. So now that my eyes opened pretty much to the point that I don't think it's going to get anymore, I have really bad double vision, so the muscle in my eye was affected because the tumor pushed my eye and my whole face forward. So it doesn't sit properly. I can't close my eye fully, so it's constantly dry, and still majority of the left side of my head is numb. So that is what happened with me in the last year. Progress-wise,
Don't get there yet.
No, just kidding.
Don't get there.
Not
No.
doing that.
Thank you, Natasha. Yeah, thank you. We'll get there, but just not yet. Thank you so much. Gil.
I'm Gil. Hi, everyone. This is really hard to follow, but I guess I'm the senior person on this panel, so I'm last.
Our team leader. Yeah.
So I never had a headache. The only symptom I had was dizziness, severe dizziness. I went to the emergency room 3 times and was told I had vertigo and sent away. But I knew there was something wrong. There was a pressure in the back of my head. Then I lost the hearing in my left ear, and my balance was really off. So I went.
Sorry, Gil, can you make sure you talk into the mic just so the
sorry.
people can hear us? That's okay.
My balance was
That's
really
all
off.
right. Thank you.
So I went to my family doctor, who sent me to an ear, nose, and throat specialist because I couldn't hear from my left ear. But before that appointment, I consulted with Dr. Goold, and Dr. Goold told me I could possibly have a brain tumor. When I went to the appointment after his examination, I said, well, I think I might have a brain tumor. And he said, no, you have more chances of winning a lottery than having a brain tumor. So I had the brain tumor. Now I'm waiting for the lottery. Anyway, that was in September, and this was 13 years ago. I then had an appointment with my neurologist in October. My neurosurgeon, I mean, and my surgery was scheduled for January. My tumor was in the brainstem, and it affected my balance and my hearing. And he told me the surgery would be 7 hours, if not more. He thought it was benign, but said he wouldn't know for sure until he went in. I had really long hair at the time. Nobody told me that they didn't have good hairdressers in the surgery room. So when I came out, the right side of my head was all shaved off, and the left side was down past my shoulders, which was really frustrating for me because hair is very important.
Absolutely.
So then, after my surgery, I went home. I was released after 5 days after my 7.5-hour surgery. And I ended up with a cerebral fluid leak through the 52 staples in the back of my head. I went back to the hospital. In the emergency room, they took out the staples and restapled me in the emergency room. Then sent me home. Oh, no, sorry, they didn't send me home. They had to test the fluid because it's spinal fluid that comes out. And once it reaches the air, you're susceptible to meningitis and encephalitis. So I was in the hospital for 5 days. Luckily, everything was negative. They sent me home. I had another cerebral fluid leak. Had to go back, redo the staples, stay in there for another 5 days. And I should mention, I had the same room all 3 times I was in the hospital, so I thought, this is an omen or something. Like, how do you get so lucky? And that may have been my lottery, right? So my neurosurgeon came in, and he said that he thought that I never was draining properly. The spinal fluid wasn't draining properly, so they would have to put a shunt in. So a month after my big surgery, I had a permanent shunt put in. I went home, and on that side I had 15 staples, so along with the 52 I had 15 more. And then they told me that they left a piece of the tumor because it was on my optic nerve, but they got most of the other part out. 5 years later, I should now mention, I was hoping to make it to 1 year. It's now 13 years since my surgery. 5 years after the shunt was put in, I had gamma knife surgery, which is non-invasive surgery. And it's been 9 years since gamma knife. So I don't go back for an MRI for another 3 years, which will give me 12 years on my gamma knife and a lot more on my first surgery.
Yeah. Thank you, Gil. Hang on to the mic, so I'm going to ask you the next question. So what was the greatest impact since diagnosis, and what would you tell someone who has been recently diagnosed with a non-malignant brain tumor to be aware of?
Well, the one thing for me was my balance and my hearing, because I'll never get that back. So in my younger days, my balance was off because I was probably drunk or something.
But not so much now.
Now it's natural.
Yeah.
So.
Yeah. So what would you tell a newly diagnosed non-malignant brain tumor survivor? What kind of words of wisdom would you want to give him or her?
Well, now I would say there's support out there. When I was diagnosed, I had nowhere to turn. I didn't know anyone who had a brain tumor. There was no information in any of the doctor's offices. I didn't know what to do. And some close friends who I thought were close, when I told them I had a brain tumor, right away they said, "You're going to die." So I didn't want to talk to them again.
Yeah. So
But I knew nobody with a brain tumor. So I felt very alone. I was really scared. I had a friend who was very supportive because she had gone through cancer, not brain cancer. She told me it was okay to be depressed, just don't stay depressed, but you're allowed to go through all these emotions, anger and why me and pity yourself and all this. Just don't stay at that level. So I guess now I see there's more support, but when I went through it 13 years ago, I had nobody to talk to.
Yeah. So that making sure that you're connected to a community and saying that it's okay to feel depressed or it's okay to feel pity, but just don't stay
at that
Thanks,
level.
Gil. Natasha, same question. What was your greatest impact, and what would you tell someone who has just been newly diagnosed?
Again, I think kind of along the same lines, just you're not alone, and to make sure that you really advocate for yourself. If you feel something is wrong, if you want a test done, we're here in Canada. Go get that test done. Talk to your doctor. And don't minimize what you're going through or what your situation is because it's non-malignant. I found that even when I found out I had a brain tumor, one of the first things I asked my doctor when I was in this state of shock was, do I have cancer? Because that's the first thing you think of. And it's a big, scary word. Well, then not long after that did I find out that having any type of brain tumor, cancerous, not cancerous, malignant, non-malignant, however you want to describe it, there's not always as many differences as people think there are. You can have a non-malignant brain tumor that gets treated like a cancerous brain tumor. There's actually a lady in our support group who they told her that if your tumor was cancerous, we would have known how to treat it better. We would have known what to do. But because it was non-malignant, she had to go through a lot of different things. So advocate for yourself. Don't minimize what you're going through because some people, like Gil was saying, you don't have a headache, you don't feel pain. There's a lot of people, again, we're all from the support group in Ajax, so we've heard kind of all of our stories, and no two stories are the exact same. And so just know that what you're going through is just a part of your journey, and it doesn't mean it's the end. There's always a light at the end of the tunnel, and you're not alone. Make sure you reach out.
Great, thank you. Before you answer that question, if there are any questions in the audience too, just let me know by raising your hand, okay? And I'll come around with the mic, and you can just have your question then. Jenny, go ahead. Greatest impact.
Greatest impact has definitely been on my family. I have young children, and I lied to them when I was going into surgery, said I had a problem with my eye. I didn't want to scare them. My family, including me, just learning to accept the new me. My whole life has changed in every single aspect, the way I think, the way I sleep, the way everything. So it's been very hard, and that's why before I said it, it's really just now that I'm kind of processing all of the trauma of that. Something I would say to a new diagnosis would be, you got this, and allow yourself to go through all of the experiences you need to. You need to grieve, you need to go through that, and allow yourself.
Thank you.
And if I can comment on lucky, I know a lot of people tell us that we're lucky, that we don't have cancer.
That's what you don't say, right?
Please. Well, I've been thinking about this, and I think I'm lucky that my children are healthy. I'm lucky that I have a wonderful husband and a wonderful family. I have never once said I am lucky my tumor is non-malignant. Yeah. It just, I have a brain tumor.
That should be a slogan.
Yeah. I'm not lucky.
yeah, that's a great point.
Yes.
Yeah, thanks for sharing that, Jenny. Comment from Janet.
Hi, my name's Janet, and I coordinate the walk in Edmonton. And I very much live in the world of gliomas and malignant brain tumors. I really appreciate hearing this. I'm well aware that benign is not benign. It's nice to hear it right from you. And I have a goal this year with the walk of making something for our non-malignant brothers and sisters, just to make sure they know we don't want you to not feel welcome. I don't know if that's just my perception.
I completely agree with you. But I think for us, it's not even to have our own thing. It's just to have the inclusion. There's so much talk about brain cancer, and there's so many services that non-malignant survivors miss out on because that first sentence says, come to our brain tumor or our brain cancer mindfulness program. Well, I don't have cancer, so I immediately put that article down because it does not refer to me, but it does. If you read on, we are in that article. So I think a lot of it, and I've been addressing this with a lot of the people that I do counseling with and that I come across with me, and Janet had a conversation about it, about just talking to the people and saying, hey, is there a way in your article to either say cancer patients and non-malignant survivors, or just having a brain tumor heading. There are ways to kind of avoid this, and I think just making those little changes, bringing it up to the people that you see services or where you come across these documents, people are so receptive of this because it's not something they've ever thought of. It's not like we're being left out. People just don't know. They don't understand like our world and what we're going through. So mention it where you can. It's making huge changes, and it's being so received so well.
So just as far as the walk goes, I want to make it as inclusive as possible. If anybody, including all of you, have any ideas of how I can make that a reality, I love, what was it we were just saying, just some of the quotes you used about, this is my thing, this is where my head is going, is just having something with quotes from sort of the non-malignant group about, that it's okay, and we understand those types of things, but I would love that feedback.
Absolutely.
You were next.
It's kind of a quick comment and a question. I guess comment, we're talking about there's malignant and non-malignant, and then there's this one extra where one of you said not to minimize. And so I don't have a tumor anymore. It got removed. It was non-malignant, but I'm like, I feel the lowest on the totem pole. So when you talk about support, it's trying to figure that out. Yeah. And so the more ask, whether it's of you three or the group, is do you ever, like, how long does this take to hit all those stages? Like, I don't know what stage I'm at because it's gone. Like, it was here, it's gone, but it hasn't even been a year, right? So.
Well, between the three of us here, I'm the one that's most recently diagnosed and newest surgery. And all that stuff. So I'm kind of happy that you asked that question because, like I said, mine. He did go in and he drained it, but it's never something that's going to leave my head. So I'm kind of on the opposite side. But I've been told by my neurosurgeon that I'm a success case and this is never going to come back and it's not cancer and all these things, but I still kind of feel the same way as if it wasn't in my head. I feel right now, just over a year later, kind of what Jenny was saying, that the emotional side of it and the mental side of it and all of those aspects haven't really hit me until now. And now I kind of feel, I won't lie, I kind of feel silly. I don't understand why I'm depressed about this when I should be really excited that I got past a brain tumor and I'm still here and it could have been way worse. So I guess I don't have too much more to say on that. And actually, that was a big thing about me being on this panel, is finding those kind of resources. Like, I know myself, I've gone through different counseling and things like that, but I do find going to just a counselor for anybody hasn't done a lot for me. It would be really nice to have somebody that understands, okay, you had this diagnosis, okay, you've gone through this, or okay, you haven't gone through anything. From my personal experience, because like I said, the last year has gotten better. As you can see, my eyes open. These things could be really good signs, which is amazing, but on my end, I feel like I have a ticking time bomb inside of my head. And even if it wasn't there, you're constantly worried of it coming back. So I think, don't minimize what you've been through, and I don't think there's any real stages or real time of dealing with those feelings. I think it's always going to be a thing. And do you want to say something?
Good point.
I just want to say it takes a long time to accept the new you. And it took me years because I was really hard on myself. I didn't like the new me, but now I've learned to accept it, and everyone else around me has to accept it. But it took me years. Like I said, it's been 13 years since my surgery. And I went through years of being angry that I couldn't do this the way I used to be able to do it. And I think that was it, was comparing my new me to my old me. And my old me, to me, was better than my new me. But now I'm just happy that I'm here, and I've met these wonderful people, and there's other people in here from our group, and there was a lot of support. I think the one thing I'd like to say, and I've mentioned this before, I used to work, my daytime job was with Legal Aid Ontario, and Legal Aid has, in the reception areas, pamphlets on every legal problem, but they also have a generic pamphlet that lists every legal clinic in Ontario. And I really would like the Brain Tumor Foundation to put a pamphlet in each doctor's office of all the brain tumor support groups in Ontario. So when you're diagnosed, because when the neurosurgeon finishes their job, what happens? Where do you go? Like we said, to go to a group that's for cancer patients, I don't feel right doing that. People are going to look at me and say, but you don't have cancer. What are you doing here? You don't understand. But I think if there was a pamphlet that listed all the support groups that you could contact. I found our group through our local newspaper. There was an ad about a meeting, and 12 years ago I went, and I've been going ever since. But before that, I didn't know about the Brain Tumor Foundation. I didn't know where to go. So that's one of my things.
Yeah, and that's a great point. And it's hard for us because we see doctors here that are connected and healthcare professionals. We're preaching to the converted, right? And it'd be great to get all of those pamphlets and that information to the neurosurgeons. It's just some of them, despite our best efforts, they won't give that information. Yeah. Sorry, we do have one. Sorry, Gil, go ahead.
I just wanted to say, even in pharmacies where they have all the pamphlets of different things.
Good point. Yeah. Thank you.
I am a brain tumor survivor, and that's what I tell people. I had a left temporal frontal lobe meningioma. So I am a brain tumor survivor. That's all I tell people. I don't tell them anything else because I'm a brain tumor survivor. You know, and so whether it's malignant or, mine was very, very large. It had grown for a long, long time, and it was pushing the eye out of my head, and I had to have neurosurgery, and they couldn't get it all. So I had to have massive doses of radiation because brain nerves are surrounding the tumor back there that they didn't want to attempt to take away because of the brain nerves all around it. So I am a brain tumor survivor. That's all I tell people. And it's a left frontal temporal lobe meningioma. I don't even say it is non-malignant because it could have killed me. I don't say it's malignant. I'm a brain tumor survivor. So that's, you know, I mean, I've survived for a long time now. It's been over 20 years since my surgery and all the radiation, but it really affected everything in my body. Hormones, you know, just, I had the bones of a 78-year-old when I was 48, and just affected everything. So, yeah, that's how I cope with it. And
I think that's one of the hard things too, is that we become so sensitive, I guess, to what other people are saying. Other people expect us, once you have your tumor removed, to just bounce back. You know, what the expectation to go back to work and be okay again was so quick, and it, you know, people just, I look fine. You don't look at me and say, oh, what, you know, anything's wrong with you. So people expect everything to be fine, and to step away from that life or step down for it for a moment is probably one of the hardest things you'll have to do, right?
Mm-hmm.
Yeah.
So I work with Brainwave on the West Coast and help initiate the Brainwave program out there, and I also work with the Brain Tumor Walk Run every year. So I'm very much involved with the whole program, but that's all I say. So just for anybody's information, if that's what you want to say, that's all you have to say.
Yeah.
So I think it's that use of language, right? And just whether I tell people, don't let people know information that you feel uncomfortable with, right? I always call it the emotional hangover. If you wake up the next day and you think, man, why did I say that? And I should have explained to our panelists too, don't beware of the emotional hangover. Be comfortable with what you're telling, and that goes with everybody here in the audience, right? Be kind to yourself. If it's something that you don't want to disclose, or if you don't want to share, because your medical health is personal and it's yours, it's okay not to say it, or not to, like Kathy said, not to get into specifics. So thank you for that. Yeah.
Hi. What advice can you give to family members? How can we support someone who's been recently diagnosed? What to say, what not to say. How can we help out?
Wow, that's a really good question. Well, I guess there's a lot. Just the support. Just kind of like what Gil said. I think Jenny said it too. I'd say talk to them about how they're feeling. Kind of like Jenny said, you get to a point, because you can be diagnosed with a brain tumor and not have surgery and just continue to be watched and have no other complications from it other than you have this thing growing in your head. So ask them how they are feeling and what kind of they need at that moment. Be that, it's difficult because I'm going to say be that positive person that, kind of tries to keep their head up, but also let them know that you can break down. You can have horrible days. You can go through the depression. You don't have to be okay. You don't have to smile and go on like everything is perfectly fine if that's not how you're feeling. Kind of, again, like what Jenny was saying, even with me, like I said, my eye was closed for 5 months, and I'm young, and people see me doing kind of everyday life things again, because for the time that my eye was closed, I couldn't really do anything. I was literally chauffeured around with my mom kind of thing, and I have a daughter as well, so it was weird becoming a kid again and being taken care of. So once my eye opened and I had that little bit of independence back, I wanted to try and go out and do what I could. But I will also say that people see me being normal, but I'm not going to tell someone that every few minutes my head hurts. I'm not going to tell somebody that I have problems with my eye at this moment and I can't see properly. No, I deal with that kind of to myself because I don't want to necessarily talk about it all the time, and that's just me. So I don't need to tell someone every single time something's hurting, but just because they don't talk about it doesn't mean it's not going on for them. So honestly, just any way that you can support them and let them know that, you're thinking positively or you're praying or anything like that for them, but it's also okay to be upset and to feel those emotions, and do not push those away, because that's not going to get you very far. And again, reach out, because the support group has honestly saved my life. I think I was there after 2 months after my surgery, and I was the youngest one at the time, and I felt like I didn't belong. I felt like because mine was non-malignant and I had survived surgery, that I really didn't need to be there and that I didn't have a story. And I found that was completely wrong. So I'd say that hopefully that helps.
Any other? Oh, Jen,
I would
Mike,
say
please.
listen. Listening is, I find, key. I think everybody rushes to find an answer for why you're upset or how they can help you. Sometimes you just have to, you just need someone to listen. You don't need their opinion, you just need an ear.
Go.
And I don't think like them. I'm going to milk it for all I can.
Yeah. That's a great question, and I love the responses too. I love my wife. I'm on. I love my wife, but when she talks to me, one of the biggest things that I say is, before she starts, do you want me to fix it or do you want me to listen? Just so I know, and I think that Jenny picks up that theme really well. Is sometimes it's just listening, right? Most of the times when I'm hearing about the day or hearing about something that I need to do, is I'm just listening. I don't have to do a thing. But so often we go into fix-it modes, especially caregivers and parents and stuff. So as a caregiver, just ask. But before they start explaining, do you need me to fix something, or do you need me just to listen? And 90% of the time, it's just listening. We have one question over here. Thanks, Jen.
I just want to say thanks for sharing your story. And you've kind of addressed it, but how do you deal with people that have platitudes about what you're going through? So saying things like, well, at least you don't have cancer. Because from my learning of brain tumors, the impact, it's not the same, but it's still significant, and you might have more side effects than someone who did. So how do you deal with that?
I'm a very positive person. I don't ever think that somebody says that to me to be hurtful. I think it's a lack of information. I think it's ignorance, I can't think of another word, that people just don't understand. So their words of encouragement are, aren't you lucky? Are, at least it's not cancer, you know? So I don't want to look at those people and say, you know, how come you can't, or get mad at them. I might not be happy with it, but a lot of the time I just shake it off and maybe make a joke to myself. I think that helps me deal with it. I had a very hard time with my workplace. They were very pushy with me returning, thought it was the best thing for me. I was back to work 5 months after surgery and radiation and failed epically. Went back again after 8 months, failed epically, to the point now that I'm on permanent disability. And, you know, it just shows following somebody else's plan for you is not always the right plan. So, yeah, I think you have to brush it off with a grain of salt, educate, say, you know, I don't feel lucky. This is lucky about me. My children make me lucky. A non-malignant brain tumor is not lucky. So, you know, yeah, take it with a grain of salt, I guess. Yeah.
Wow.
Can I add just one thing to that?
Absolutely. I want to hear from everybody, actually. That's good.
Even before this whole brain tumor journey with myself, I've kind of said to people, I've always liked talking to people. I like if I can be there for someone. I've had a lot of people turn to me and tell me that I'm easy to talk to and things like that, which is fantastic. So I've used that in my life, but I've always said to them that no two people are going to deal with something in the exact same way. For the smallest little thing, if you stub your toe, for you it's just, oh, there's a bit of pain in my toe. For someone else, that could be traumatizing for whatever reason. That's kind of an odd example, but things like that. Right now, if my head hurts, I'm not just, oh, I have a headache, I'm going to take some Tylenol. When before it was, I have a headache, I might need sleep, I might need water, I might need these things, like what is causing this? And now instantly I'm like, my tumor's growing, this is it, I'm going to the hospital tomorrow, it's the end of my line. And that's where my brain goes, and it's frustrating because I don't want to feel that way, but like I said, no matter what someone goes through, because someone can go through this journey, and I'm not going to say have no kind of repercussions from it, but again, they might not feel a headache, they might not feel pain, they may be dealing with it in a different way, or they might have all of these other physical symptoms. They might have everything, they might have nothing, but that doesn't mean that what they're going through isn't, what's the word I'm looking for?
Significant?
Yeah, that's the one, thank you. Isn't
That's why they have
significant.
me here.
And yeah, so that's about it. Just no two people will have the same thing. We all deal with things differently.
Thanks, Natasha. Gil, any comment?
Yeah, I agree. Well, the only other thing I want to point out is I think there should be more lobbying about prescription medication being covered in Ontario. I know there's some people in our support group that are on medication but have benefits that will cover it, and it could be like really a large amount, maybe thousands of dollars a month. I don't have to take medication for my brain tumor, so I'm fortunate that way. But what happens to people that don't have the money, that can't afford these prescriptions? I mean, do you move out west so you can get covered? Like, I really think that there should be more lobbying of your local politicians to get medication covered, because if I had to be on medication that was $3,000 and $4,000 a month, I am now retired, I don't have any benefits, I would just die because I couldn't afford it.
Yeah.
You know, so I'd like to see more lobbying done for that.
Yeah, and despite people's awareness, there is an equal access of medication across the provinces, and there is a disparity, and that is stuff that we are assisting and working on. But it takes a lot of people, and a lot of people to have their voices heard. Thank you, Gil, for raising that question. So,
okay, this isn't a question. It's when I was diagnosed, I think you should go to a support group, because I didn't at first, and I was diagnosed with cluster migraines 30 years ago. I had a grand mal seizure in Florida. They were going to operate. They said they could scoop it out easily. I said no, I wanted to come home to Canada. I came home. They said it was in too deep, they couldn't operate. They wanted to biopsy it, and I said, what would you do then? They said, come back every 3 months. And I said, and then what would you do? Well, we'd just watch it. And I said, well, just leave it alone, because if you're not going to do anything, I'm not going to come back. He said, you could be paralyzed on your left side. And you talk about guilt. Well, I feel guilty because I'm still here. And I know a lot of people that have passed on. And I've had a lot of trouble with seizures and seizure medications and different medications. Finally, I'm on Keppra. They discovered Keppra, thank God. And I've been seizure-free for 3 years, and I've got my license back. I go for my G1 in February, or my G license in February. And I just want to say, I've been a member of the Jerry and Nancy Pencer Brain Tumor Family Advisory Group for 25 years. And without a support group, I don't think you can make it. I didn't want to go at first, but my son talked me into it. And I think that's where you get your strength. And I like being there because new people that come think, well, there is hope. I'm not going to die. That woman's been here for 30 years. But I do think that they should include non-malignant brain tumors, not just Brain Cancer Awareness Day.
I couldn't agree with you more with having the support group. Just being able to relate to people that know what you're talking about is huge. So your family is a great support, your friends, but ultimately the best support I found was through other people that I didn't know who they were. They just shared one commonality and a brain tumor, and they were the best people to talk to. And my neighbor, and didn't even know her.
Yeah, it's a general comment. I'm myself a non-malignant brain tumor survivor, and I totally get it, about what have been said about non-malignant versus malignant tumors. And words are important, and I would like just to remind, if necessary, everybody here how important words are. First off, the foundation's name, it's Brain Tumor Foundation of Canada. It's not Cancer Brain Foundation of Canada. So I totally get it because I felt the same at some point. I'm an imposter here somewhere, I know we're not. I will say, somebody will tell me this, but no, you're not. And I feel I am. But just to say, so remember the name of our foundation because everything is said. Second of all, and that's very important, when we're going to leave this room, we're going to be ambassadors of non-malignant brain tumors in the way that, again, words are important. I insist, and please, please, I urge every one of you here to never use benign anymore at all, because I've just heard it 2-3 times, and it's okay. You won't be punished, but please, from now on, malignant or non-malignant brain tumor, and insist on brain tumor, because yes, there's lots of suffering, there's lots of life impairing, whatever. I mean, you are so courageous, the three of you, and many others here. So please remember that. Remember that you are ambassadors now.
Well said.
Mm-hmm. Thank you so much, Michelle. One last comment from Jen, and then we're going to be out of time. Jen?
Hi, my name is Jen. I was diagnosed in 2011 with a non-malignant brain tumor. I just want to touch on something within regards to, when you tell people that you have a brain tumor, there's this, like you said, oh, you're so lucky, you're lucky it's not cancerous. I let that slide, I think, once. Yeah. I'm not going for that. I had a surgery that was supposed to be 2 days long. It ended up being 15 hours, and then I was left with the choice of, do I want them to go back in and try and get the rest out, or leave what's in there? Because if they do go back in, I could die. It's not like, okay, what color shoes am I wearing today? It's, I can live or I can die. And it's a tough choice I had to make. I came out of the surgery, one eye down, have no vision in this eye. I ended up, because I didn't go back for the second day of surgery, they ended up treating it with radiation, which is, guess what that's a cancer treatment. I was in the cancer center for 6 weeks, getting radiation to my brain. I have chronic headaches. I have a lot of nerve pain, nerve issues. I have nerve palsy, my eyelids close. So I have all this stuff going on. Plus, oh my gosh, I could talk for hours on this. I won't. But, so I am not going to let somebody diminish what I am going through by saying, oh, at least it's not cancer. I can't do that. I do understand there are differences, but to me, regardless, these things should not be in our heads. They're not supposed to be there. And non-malignant, malignant, they are wreaking havoc. They cause problems, not just for us, but for everybody around us, for our families that have to deal with us. Okay, I'll shut up now.
It's okay. Yeah. And I think the biggest takeaway here is these non-malignant brain tumors are anything but benign. Benign is harmless. These things are not harmless. They cause lifelong effects, and I know we're just scratching the surface. But we're starting by having this panel discussion here, and I really appreciate all your participation. I appreciate Jenny, Natasha, and Gil giving their time and having the courage to come up here and share your story and answer these questions. So thank you so much on behalf of Brain Tumor Foundation. Thank you for joining us.